I'm going to talk on this trial results. Using S-1, it's an oral 5FU, mainly conducted in Japan. And this is our COIs. In the background, the standard adjuvant, the chemotherapy for hormone receptor-positive HER2-negative breast cancer patients contain anthracycline and taxanes. Dose escalation of these chemotherapeutic agents may not result in the significant survival advantages. The chemotherapy with oral FU is active in metastatic situation. The multiple adjuvant trials had been conducted previously with oral 5FU have shown the positive signals. And we hypothesized that the adjuvant treatment with the S1 and in conjunction with the standard endocrine treatment would improve the survival outcomes of these patients. This is a S1 formulation, is a biochemical modulatory agent. The consisted of a Tegafur, it's a 5FU, and the Gimlacil or Teracil, 1.4 and 1 it's a ratio. S1 will be orally administered twice daily for 14 consecutive days. It's a continuous oral administration and 1 week off. And the Q3 regimen repeated for 1 year time. And the dose determination for each individual was done like this. So using the creatinine, it's a renal function, and also the body surface area. Something like if the renal function is normal, and the body surface area is the 0.25, 0.1, then we can start with 100 milligram per day. This is a trial design. The simply comparing standard endocrine treatment and the S1 1 year. The eligibility criteria was the stage 1 to 3, and the node positive and node negative, and the intermediate or high risk patients were recruited to this trial. Randomization was done 1 to 1. The primary endpoint was the invasive disease-free survival. And the secondary endpoints were the OS, the disease-free survival or distant DFS, safety, and biomarker things. The stratification factors were age, 55 years old, and also the nodal status, the chemotherapy plus minus, the preoperative endocrine treatment plus minus, estrogen receptor status low or it's not low, and institutions. This is statistical analysis planning. The control group, the 5-year IDFS was estimated as 83%, plus S1, 87.8%. Hazard ratio was 0.7, it's a target, and alpha 0.5, they two-sided. The 5 years follow-up and 3 years enrollment, 332 events were expected from the 915 patients. So again, the key inclusion criteria, stage 1 to 3. If stage 3B, radical rejection, and the after preoperative systemic treatment PST is needed, and the with or without PST, and within 1 year after surgery, and within 6 months after starting the adjuvant endocrine treatment, you can start with S1. This is our risk assessment for this particular trial. On the right-hand side, without the neoadjuvant systemic treatment, mainly chemotherapy. Without PST, if the nodal involvement or lymphovascular invasion is positive by pathologist, it's eligible. If not, grade 3 is eligible. Grade 2, over 2 centimeter eligible. The grade 1, over 3 centimeter eligible. But grade 2, less than 2 centimeter. Grade 1, 2 to 3 centimeter. We use the Ki-16 level index. Over 30% is eligible. If over 14%, we use the Oncotype DX testing. With PST, neoadjuvant chemotherapy mainly, if node positive or the breast, the residual disease positive, I guess the non-PCR cases, it was eligible. With neoadjuvant endocrine treatment, if node positive, it's eligible. If node negative, we use the same criteria as without BST. This is a consult diagram. The 1969 patients actually randomized. The full analysis set altogether the 1930. So equally randomized, the baseline demographic of these patients, the right-hand side plus S1, 957 patients were randomized. Age, the 51, the premenopausal, postmenopausal 50-50, body weight 55 kilogram on median, and the histological grade 1 is included at 10%, grade 2, 60%, grade 3, the 26%. Node positivity is roughly the 30%, the 1/3 was roughly node negative, 2/3 node positive. Ki67 labeling index, the less than 14%, the 54%. The 14 to 30, the 31%, over 30%, the 13%. Chemotherapy neoadjuvant, the 20%. The post-operative, the adjuvant chemotherapy is 35-6%. So roughly the 55 to 56% were treated by chemotherapy in this trial. Invasive diameter, the less than 2 centimeters, 31%. The over 3 centimeter, 21%. This is our core result, the primary endpoint, the invasive disease-free survival. This trial was actually terminated early because the primary endpoint was met. And in the interim analysis, the median follow-up was 51 months. And the 155 events were identified in the control group and 101 in the S1 group. 81.6% in the control group, it's a 5-year IDFS, and the 87% in S1 group. The hazard ratio is actually 0.63, and the p-value was at the less than 0.001. Safety profile. The S1 is a chemotherapeutic agent that caused the bone marrow toxicity, such as neutrophil counts, the decreased, the 42% all grade, but grade 3, 7.5%. It's obviously significantly different. And the platelet decrease also the significantly different in all grade, but the grade 3, 0.5%. GI toxicity is the more frequent in S1 treatment group, and the diarrhea 32% in all grade and 1.9% for grade 3. It's statistically significant. Obviously, hyperpigmentation is quite often in S1 group, the 50%. So as a conclusion, the oral formulation continuous treatment, the metronomic types treatment with S1, 1 year adjuvant, together with the endocrine treatment would be important treatment option for estrogen receptor positive, HER2 negative, the primary breast cancer patients having intermediate and the high risk of recurrence. And the safety profile is within expected, and it's quite manageable. That's all. Thank you very much.